Hey there, students! We'll look at the anatomy of the hip joint today. The existence of articulations or connections between the skeletal elements enables the entire body to be mobile. The hip joint is especially an important joint as it helps us stand, walk, run, and jump. It is the main joint that connects the lower limb to the axial skeleton. I am David, and I will be teaching you all about the basic anatomical structure of the hip joint. We will talk about the muscles and the ligaments that provide support to this joint. Then my colleague here will walk you through the rest of the lecture.
Hi, I am Sarah, and I will tell you about neurovascular supply and movement at the hip joint. Lastly, we will discuss some common injuries and conditions related to the hip joint.
So, let's dive right into the topic of hip joint, starting with the question, what is the hip joint? As you may already know, a joint is a place in your body where two bones meet. Here is the location of the hip joint. It is one of the largest joints in your body, after knee joint, that we will discuss in a separate video. The hip joint is a connection point between your thigh bone, that is the femur, and the hip bone or pelvis. In a previous video, we have discussed the classification and types of joints found in the human body. Another question may have come into your mind. What type of joint is the hip? The hip joint is a ball and socket joint. Here the femur is a long bone with a rounded top. The ball is the femoral head, and the socket is the acetabulum, which is part of the pelvis bone. The round part of your femur fits into a cup-like socket in your pelvis called the acetabulum. The femur bone, which is the largest bone in the human body, connects to the pelvis at the hip joint. The hip joint is a ball and socket joint. That means it is a freely movable diarthrodial joint that allows a wide range of movement. We will discuss that at a later stage. If we talk about the structures of the hip joint, the hip joint is made up of several important structures, including bones, cartilage, synovium, bursa, ligaments, and muscles. The bones involved in the hip joint are the femur, which is the thigh bone, and the hip bone that makes up the pelvis. The smooth cartilage covers the femoral head and the acetabulum socket, acting as a cushion that helps to absorb impact during movement. The synovium is a thin covering that surrounds the bones in the joint and produces a fluid that lubricates the joint, allowing for smooth movement without friction. Here in this diagram, the orange highlighted part is the synovial cavity, making the hip joint a diarthrodial joint. The bursa is a fluid-filled sac that cushions the bones, muscles, and tendons, providing a smooth surface for them to move on. Ligaments are tough bands of connective tissue that connect bones to bones, specifically connecting the femoral head to the acetabulum. Several large muscles support the hip joint and enable movement, including the gluteals, adductor muscles, iliopsoas muscle, quadriceps, and hamstrings. These muscles work together to provide stability and help you perform a wide range of activities. That was just a general overview of what makes up the hip joint. Let's talk about them in a little detail. The hip joint is created by the connection between the femur's head and the acetabulum, which is a concave depression located on the side of the pelvis. To enhance the fit and stability of the femur in the acetabulum, a fibrocartilage collar known as the acetabular labrum surrounds the acetabulum and deepens its cavity. Here you can see that both the acetabulum and head of the femur are covered in articular cartilage. The head of the femur is hemispherical or rounded, and it fits perfectly into the concave shape of the acetabulum. Both the acetabulum and head of the femur are covered in articular cartilage, which is like a smooth, slippery coating that helps reduce friction between the bones during movement. And to ensure that the joint is stable and strong, there's a capsule that surrounds the hip joint. This capsule attaches to the edge of the acetabulum on the pelvis and to the intertrochanteric line, a bony ridge on the femur at the top of the thigh bone. The ligaments of the hip joint surround this capsule and provide strength to this complex joint. The hip joint has both intracapsular and extracapsular ligaments that help provide stability and support to the joint. First, let's talk about the intracapsular ligament. The intracapsular ligament of the hip joint is called the ligament of the head of the femur, also known as the round ligament of the femur or the ligamentum teres femoris. It runs from the acetabular notch of the hip bone to the fovea capitis of the femur and helps to anchor the femoral head within the acetabulum. It encloses a branch of the obturator artery, which is a minor source of arterial supply to the hip joint. Now, onto the extracapsular ligaments. The extracapsular ligaments of the hip joint include the iliofemoral ligament, pubofemoral ligament, and ischiofemoral ligament. These ligaments are continuous with the outer surface of the hip joint capsule. The iliofemoral ligament is the strongest of the three ligaments, and it arises from the anterior inferior iliac spine, a bony projection on the hip bone, before bifurcating and inserting into the intertrochanteric line of the femur, a bony ridge on the thigh bone. It has a Y-shaped appearance and prevents hyperextension of the hip joint. The second extracapsular ligament is called the pubofemoral ligament. The pubofemoral ligament spans between the superior pubic rami, the bony extensions on the front of the hip bone, and the intertrochanteric line of the femur. It has a triangular shape and reinforces the capsule anteriorly and inferiorly, preventing excessive abduction and extension. Finally, the third extracapsular ligament seen in the region of the hip joint is ischiofemoral ligament. This ligament spans between the body of the ischium and the greater trochanter of the femur. It has a spiral orientation and reinforces the capsule posteriorly, preventing hyperextension and holding the femoral head in the acetabulum. Overall, these ligaments work together to provide strength and stability to the hip joint, allowing us to perform a wide range of movements and activities. That is all about the ligaments. Let's move on ahead and talk about the muscles of the hip. There are two perspectives to categorize the muscles that surround the hip joint. Firstly, according to their location in relation to the joint, which can be superior, inferior, anterior, or posterior. Secondly, according to their function, which includes acting as flexors, extensors, abductors, adductors, and rotators.
I will talk about the second criterion later on.
First, let's go through the relations of the hip joint. If you look at this illustration, in the center is the hip joint. Taking the joint as the reference point, you can see that, at the superior aspect, we have the following muscles. 3 gluteus muscles. Gluteus maximus, gluteus medius, gluteus minimus. There is also the reflected head of the rectus femoris, sartorius, and tensor fasciae lata. At the inferior aspect of the hip joint, we find the lateral fibers of the pectineus and the obturator externus. In addition, there are gracilis, adductors longus, adductors brevis, adductors magnus, and quadratus femoris. To remember the names of the muscles that we have discussed so far, you can make use of mnemonics and acronyms. For instance, for the muscles that are superiorly related to the hip joint, use this sentence: glorious gladiator, and the 3 T's. The first part, glorious gladiator, refers to the 3 gluteal muscles: gluteus maximus, gluteus medius, and gluteus minimus. The second part, the 3 T's, refers to the 3 muscles in the thigh: the rectus femoris, sartorius, and tensor fasciae lata. To make it even more memorable, you could create an image, a gladiator, in your mind of someone doing a T shape with their legs, with one leg straight and the other leg bent at the knee. The straight leg represents the rectus femoris, the bent leg represents the sartorius, and the T shape of the legs represents the tensor fasciae lata. This visual image could help you recall the muscles more easily. As for the mnemonic to memorize the muscles that are inferiorly related to the hip joint, you can use this sentence: quite people often get a bit mad. Q is for quadratus femoris, P for pectineus, O for obturator externus, G for gracilis, A for adductors longus, B4 adductors brevis, M4 adductors magnus. Now that you have these mnemonics to remember the superior and inferior relations of the hip joint, let's move on and look at which muscles lie anterior to the hip joint. At the anterior aspect lies the tendon of the iliopsoas, separated from the joint by a bursa. You can also see the femoral nerve, femoral artery, and femoral vein here. As for the posterior aspect of the hip joint, the joint, from below upwards, is related to the following muscles. Tendon of obturator externus covered by the quadratus femoris. Tendon of obturator internus with gemelli. Piriformis. Sciatic nerve. And the gluteus maximus muscle. That is all about the muscles that are closely related to the hip joint. Now my colleague here will help you understand how the muscles of the hip joint can be grouped based upon their functions relative to the movements of the hip.
The hip joint is a ball and socket joint that allows for a wide range of movements in multiple planes. The types of movements possible at the hip joint include flexion, bending the hip joint so that the thigh moves towards the abdomen. Extension, straightening the hip joint so that the thigh moves backward. Abduction, moving the thigh away from the midline of the body. Adduction, moving the thigh toward the midline of the body. Internal rotation, rotating the thigh inward toward the midline of the body. External rotation, rotating the thigh outward away from the midline of the body. These movements at the hip joint are only possible due to the action of different muscles. So, the muscle that bring about flexion are called the flexors. These are psoas major, psoas minor, iliacus, rectus femoris. A simple mnemonic to remember these muscles is, people might perceive it as reckless, where each capitalized letter represents a muscle as shown here. As for the extensors of hip joint, these are gluteus maximus and hamstrings. As for the abductors of hip joint, gluteus medius, tensor fasciae lata, sartorius. The adductors of hip are the muscle of medial compartment of the thigh. These are adductor magnus, adductor longus, adductor brevis, gracilis, pectineus. These muscles abduct the lower limb at the hip joint. As for the internal rotators, tensor fasciae latae and the anterior fibers of the glutei, medius and minimus, bring about internal rotation. Lastly, the external rotators of hip joint are gluteus maximus, superior and inferior gemelli, obturator externus, obturator internus, quadratus femoris, piriformis. Knowing how many muscles surround the hip joint makes it clear that these muscles require nerve and blood vessel supply. If we talk about the nerve innervation of the hip joint, a joint tends to be innervated by a branch of a motor nerve which also supplies a muscle extending and acting across the joint. Another branch of the nerve often supplies the overlying skin. The hip joint is innervated by three main nerves: the obturator nerve, the femoral nerve, and sciatic nerve. The obturator nerve is considered the primary source of innervation to the hip. The obturator nerve provides sensation to the inside of the thigh and helps to control the adductor muscles. Here you can see the muscles that are supplied by branches of the obturator nerve. Branches of the femoral and sciatic nerves contribute to its sensory innervation. The femoral nerve provides sensation to the front of the thigh, gives off two articular branches and helps to control the quadriceps and other muscles. Finally, the sciatic nerve. It is the largest nerve in the body and provides sensation to the back of the thigh and leg. In terms of blood supply, the hip joint is supplied by the obturator artery, gluteal arteries, and two circumflex femoral arteries. The obturator artery is an important blood vessel that supplies blood to the pelvic region and the hip joint. It arises from the internal iliac artery and travels through the obturator canal to reach the medial compartment of the thigh. Along with the obturator nerve, it passes through the obturator foramen, a bony opening in the pelvis, and supplies the adductor muscles of the thigh. The gluteal arteries, to be precise the superior and inferior gluteal arteries, are two important blood vessels that supply the muscles and tissues of the gluteal region, which includes the buttocks, as well as the hip joint. The superior gluteal artery arises from the posterior iliac artery. It travels through the greater sciatic foramen, a bony opening in the pelvis, and supplies blood to the gluteal muscles, including the gluteus maximus, medius, and minimus, as well as the tensor fasciae lata muscle. It also contributes to the blood supply of the hip joint capsule and the ligaments that stabilize the joint. The inferior gluteal artery also arises from the anterior iliac artery and travels through the lesser sciatic foramen. It supplies blood to the gluteus maximus muscle and the muscles of the posterior thigh, including the hamstring muscles. As for the two circumflex femoral arteries, these are called the medial and lateral circumflex femoral arteries. They form an arterial circle around the capsular attachment on the neck of the femur. A small part of the head, near the fovea capitis, is supplied by the acetabular branches of the obturator and medial circumflex femoral arteries. These nerves and vessels have been discussed in detail in our videos on the region of the thigh. If you wish to learn more about them in more detail, don't forget to check out our other lectures here at sqadia.com. We are just about to end our video. In the beginning I said that I will also talk about some clinical conditions relevant to the hip joint. Hip injuries and conditions are common, especially as we age. Some of the most common hip injuries include hip fractures, osteoarthritis, labral lesions or tears. A hip fracture is a serious injury that occurs when the upper part of the femur is broken. As you can see here, the bone can be fractured at different places. This type of fracture typically occurs in older adults, particularly those over the age of 65, and is often the result of a fall. Hip fractures can be very painful and can make it difficult or impossible to walk. In addition, they can increase the risk of other health problems, such as blood clots and pneumonia, particularly in older adults who may have other medical conditions. Osteoarthritis of the hip joint is a common type of arthritis that affects the hip joint. It occurs when the cartilage that cushions the joint wears down over time, leading to pain, stiffness, and decreased mobility. Symptoms of hip osteoarthritis can include pain in the hip or groin area, stiffness in the joint, a decreased range of motion, and difficulty walking or performing everyday activities. It is more common in older generation, and in severe cases, the joint may become deformed, leading to further pain and disability. Total hip replacement is a common and effective treatment option for both fractures and osteoarthritis of the hip joint. During a total hip replacement, the damaged hip joint is removed and replaced with an artificial joint made of metal and plastic components, as shown here. For hip fractures, a total hip replacement may be necessary if the fracture is severe or if the bones are unable to heal properly on their own. In these cases, a surgeon may remove the damaged bone and replace it with an artificial hip joint. For osteoarthritis of the hip joint, a total hip replacement may also be recommended if other treatments, such as medication and physical therapy, are not effective in relieving symptoms. Labral lesions are injuries to the labrum, which is a ring of cartilage that surrounds the socket of the hip joint. Labral tears occur when the cartilage that lines the hip joint is torn. The labrum helps to cushion and stabilize the hip joint and is important for normal hip function. They can cause pain in the hip or groin area, as well as stiffness and a feeling of instability in the joint. Labral lesions can occur as a result of trauma, overuse, or degeneration due to age or other conditions. Hip bursitis is a very uncommon ailment that causes the bursa to become inflamed. Inflamed bursae in the hip joint can cause discomfort, edema, and stiffness. Treatment for hip bursitis typically involves rest, ice, and anti-inflammatory medication to manage pain and swelling. Physical therapy may also be recommended to help strengthen the muscles around the hip joint and improve flexibility. In some cases, injections of corticosteroids or local anesthetics may be used to reduce inflammation and pain. So, there you have it, a comprehensive overview of hip joint anatomy. We've covered the basic anatomy of the hip joint, the joint structures, muscles, nerves, and blood vessels, as well as common injuries and conditions. Understanding hip joint anatomy is critical for healthcare professionals and patients, and I hope you found this lecture both informative and engaging. We will be back to teach you about the other joints of the lower limbs, so stay tuned.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.